Question 71. Mrs. Shumway's nursing care plan lists CHF, congestive heart failure, as a primary DX diagnosis. You'd expect her ADL routine to include A. Encourage oral fluids, B. Daily jog around the facility for 1 hour, C. Daily weight measurement, D. Placement of TED hose after ambulation. Answer C. Explanation. Congestive heart failure is a chronic disease that happens when the heart becomes weak and is unable to pump efficiently. It is important to monitor the client's weight because sudden weight gain means that the client is retaining fluid. This puts a strain on the heart and lungs. The nurse aide should weigh the client every morning at the same time and record the weight. Notify the nurse of any sudden change. Question 72. A patient appears more pale than usual. The nurse aide should A. Note it on the chart, B. Offer a glass of water, C. Get the patient a snack, D. Ask the patient how he feels and take his vital signs immediately. Answer D. Explanation. Whenever noticing any change in the client's condition, stop to assess the client and take vital signs. If the client is able to respond, ask how the client feels. Report the changed vital signs and client's response to the nurse. When charting, document what you observed and did. Question 73. To help ensure adequate circulation to prevent skin breakdown, you could A. Change the patient's position frequently, B. Perform active or passive range of motion exercises, C. Give back massages, D. All of the above. Answer D. Explanation. One of the primary responsibilities of a nurse aide is to monitor the client's skin for any signs of breakdown. During baths, dressing, or position changes, inspect the skin for redness, pallor, warmth, or bruising. Reposition at least every 2 hours, protecting areas that rub together as well as the bony prominences. Massages to the back and buttocks can promote circulation. Range of motion exercises are also helpful. Always report any signs of breakdown to the nurse. Question 74. Postpartum refers to A. The period of time right after death, B. The period of time right before delivery of a baby, C. The period of time just before death, D. The period of time after delivery of a baby. Answer D. Explanation. Postpartum is the medical term that means after giving birth. The prefix post always means after in any medical term. For example, post-operatively means after surgery, and post-discharge means after leaving treatment. The term partum refers to giving birth. Question 75. Which of the following is associated with smoking? A. Vitamin C deficiency, B. Heart attacks, C. Pneumonia, D. All of the above. Explanation. The effects of smoking can cause many diseases and medical complications. While cigarette smoking is the main cause of lung cancer, it also causes other lung conditions such as COPD, emphysema, and pneumonia. Smokers are more likely to develop heart disease and have heart attacks and strokes. Vitamins are depleted in smokers, especially vitamin C and the B vitamins. Question 76. Which of the following measurements you obtained from Mrs. Shumway should be reported immediately to the charge nurse? A. PB 190 per 114. B. Temperature 99 degrees F. C. Pulse 74. D. Respiration 20. Answer A. Explanation. Hypertension is defined as a blood pressure over 140 per 90. Severe hypertension is above 180 per 120. Even if the client has a history of high blood pressure, always immediately report a sudden increase to the nurse. Untreated hypertension can lead to heart disease and stroke. Question 77. A nurse assistant notices red marks on the resident's back and buttocks. The aide acts in the knowledge that A. It takes the doctor's order to rub skin with lotion. B. Red marks are not a problem. C. The skin can break down if nothing is done. D. Patients can only be toned every 2 hours. Answer C. Explanation. A reddened area is the first sign of skin breakdown. It means that there is pressure and a lack of blood circulation to the area. The nurse aide should immediately reposition the client to eliminate pressure. Clients who are not mobile need to be repositioned at least every 2 hours. Never massage a reddened area, as this will increase the damage. Keep the client clean from perspiration, urine, and feces. Continue to observe the skin and report to the nurse if the marks do not quickly disappear. Question 78. A nurse aide notices blood in the patient's IV tubing. The aide should A. Stop the IV. B. Do nothing. That's normal. C. Notify the IV nurse. D. Try to flush the tubing. Answer C. Explanation. When an IV is running well, the tubing should be clear and the IV side clean and dry. If blood is noted in the tubing, notify the nurse. It is beyond the scope of practice for a nurse aide to do anything with an IV. Question 79. In the nursing care plan you note it is written O2 per NC at 3 liters. Ortho NIBA pose as needed. As a CNA, you know this means A. Resident has oxygen with a nasal cannula on 3 liters. Assist to seat in fallus. B. Oral care every 3 hours. C. Orient new client at 3 o'clock to orthopedic unit. D. Resident is to be amputated every 3 hours. Answer A. Explanation. This nursing care plan means that the client is receiving oxygen at a constant rate of 3 liters per minute, using a nasal cannula. If the client has difficulty breathing, the CNA can assist the client to sit in a fowler's position. Every facility has a list of approved abbreviations. The CNA should become familiar with these for reading care plans and for doing documentation. Question 80. Drainage bags from urinary catheters should always be fastened securely to the bed frame. B. Be kept below the level of the bladder. C. Have the output measured each week. D. Be changed every shift. Answer B. Explanation. Drainage bags from an indwelling Foley catheter should be kept below the level of the bladder to prevent urine from backflowing into the bladder. It also allows gravity to help drain the tubing. Check that the tubing is not kinked or compressed. Depending on the reason for the catheter, urine may have an unusual appearance. Ask the nurse what is abnormal for the patient. Monitor and record the color of the urine, as well as observations such as sediment, cloudiness, or blood. Follow your facility's policy or the patient's care plan regarding how often to change the urinary drainage bag. Thank you for watching.